Hi, my name is Eileen Hsich. I'm the Medical Adult Heart Transplant Director for the Cleveland Clinic, and I'm here with this amazing team to actually celebrate our 2,000 heart transplantations at the Cleveland Clinic. We have both the pediatric as well as the adult teams here today, and we briefly want to just thank everyone for all that you have done and helped us achieve this accomplishment. I'm going to start with the pediatric team first. Dr. Hani Najm, our surgical director, please will wave and say hello.
Great, thank you. Thank you so much, Eileen. It's a pleasure to be with this amazing team. And indeed, we are actually delighted with this 2,000 heart transplant. It happened to be a pediatric heart transplant. We started our program in 1985, and since then we've done more than 170 cases of heart transplantation with another 10 who are redo transplantation, multiple ventricular assist devices of all the spectrum from CenterMag, Berlin hearts, HeartMates, all the spectrum of assist devices that have been used before the transplantation. We're very proud that we're attached to a very strong, powerful, one of the most powerful programs in the world for heart transplantation, the adult transplant program, because we are basically starting off with the kids with the congenital heart disease that they eventually become adults and they may need help with the heart transplantation. We have innovated on multiple platforms, including the medical management, specifically when we have switched from management of Berlin hearts from heparin to bivalirudin, and this has dramatically changed the outcome of this assist device. In addition to that, we're working in the lab to produce a miniature total artificial heart that would be implanted for infants and young children that would help us also bridge these patients to either a full transplantation or a permanent device. This all work has happened over the past many years, and this is exemplified by the 2,000 heart transplantation, which she developed acute myelocytic leukemia, and she developed cardiomyopathy from chemotherapy, and she needed, so her ventricular function has deteriorated substantially, eventually needed a mitral valve repair. We thought that we could actually bridge her into a longer term. Unfortunately, the heart continued to deteriorate and eventually needed an assist device. We've inserted an assist device for her, the CenterMag, which has done well for her for a few months, as a matter of fact, until she received her heart transplantation. And since then, she has done extremely well, and she's actually on the verge to go home. So we're so delighted with the collaboration that this amazing team that brings up together, as well as the research that is going on behind these doors in the lab. Thank you very much, Arlene, for this opportunity, and we're so proud of being in this amazing team.
Well, thank you very much. And I also want to introduce Dr. Gerald Boyle, who is the medical director of the pediatric program. And before you begin, I want to brag for you. Your 3-year survival for the SRTR for pediatrics is 95%. That is amazing, since the national average is only 89%. So why don't you tell us about the medical innovations and challenges that you've faced over the years? And you've obviously done an amazing job.
Well, thank you, Eileen. I really appreciate your kind words and the ability to I appreciate more the ability to work with this amazing team. It is a very collegial team. I have been here for now 15 years, 16 years, and the amount of support we get and give to our adult program has been amazing. Our first heart transplant in pediatrics was done in 1985, as Dr. Najm said. In the early 2000s, we developed some innovations in the medical therapy of transplant. We started using induction therapy at that point, and in fact started using it in the operating room at the time of transplant. That has resulted in a dramatic decrease in acute cellular rejection. in fact, it's an incredible rarity that we see this. We have done 178 or 79 transplants in pediatrics now, and it has been with full support of both teams. I feel very lucky to be able to call on my adult colleagues to come on down and help me think about patients pre-transplant, and even at the time of transplant, we've had some support there. Our team is small, but we're mighty. And we continue to innovate. As Dr. Najm said, we have full use of all of the available devices, again, thanks to our adult colleagues. And our subspecialty team includes our infectious disease, our pathologists. It really does take an entire village to get these amazing results, not done in isolation at all. It was an exceptional challenge, and on a continuous flow device with a Centromag for several months, was successfully transplanted 16 days ago, underwent her first heart cath today, post-transplant and biopsy. Again, no rejection, and we are planning to send her to our rehabilitation hospital early next week. So again, the teamwork that is personified by the Cleveland Clinic has really driven this program, and I believe we will continue to excel and accelerate in our care of patients. Thank you.
Well, thank you. Really appreciate it. I also want to add how important it is, our multidisciplinary approach. That is really the glue of everything. Every pediatric and adult patient that comes to the Cleveland Clinic is reviewed by a multidisciplinary team that makes sure that the right therapy is selected for each patient. That team consists of nurses and nurse practitioners that specialize in heart transplantation, as well as mechanical circulatory support, such as left ventricular assist devices. We have clinical pharmacists that round with us in the hospital to ensure that there are no drug interactions, and also to make sure that the patients are compliant with their therapy. We have social workers that evaluate the patients and also manage their psychosocial concerns both pre and post-transplantation. We have medical assistants that ensure that the patient's questions that are answered both pre and post transplantation. And we have a nutritionist that ensure that the patients are properly diagnosed with malnutrition and managed for this in advance. Like every center, we also have allergen lab specialists that really match our patients with their proper donor. And of course, we have cardiologists and surgeons and doctors in training that really make this all happen. And we're really well aware that the patients that come here are afraid often, they're scared, and many come as a last resort after they've been declined elsewhere. And we recognize the importance of that, and we take a comprehensive approach and together review all the images so that we're not just discussing it, we're looking at it with a lot of different eyes to make sure that the right therapy is given to all patients. I think one of the things that shows how much of a team we are is really our experience through COVID. This really wasn't something we anticipated. This was something that required actually a lot of effort. And Dr. Michael Tong, who is our Director of Mechanical Support, Circulatory Support for Adults, is here today to talk about how we've kind of managed and successfully transplanted patients through this process. Dr. Tong?
Yes, thank you, Dr. Hsich. It is such an honor and pleasure to be part of this wonderful team, and it's really exemplified of the things that we were able to accomplish during this COVID period. As COVID swept across the country, and particularly in the East Coast, many large transplant programs were shut down because of the lack of ICU space. Also, patients who are transplanted are immune suppressed, and that means they are at extra heightened risk of getting COVID. Well, we recognize that that this is a pandemic that was affecting the whole country, it is still very important to us that we are able to continue to take care of our patients. So we had to change some of the process of how we did things here at Cleveland Clinic to ensure that our patients continue to get the care that they needed. In our hospitals, we created COVID-free zones where any patients who enter these zones, enter these units, had to be tested negative prior to them being able to enter, and essentially created bubbles within the hospital for our transplant patients pre and post-transplant. In addition, we had to make sure that our caregivers are safe and protected as well, particularly when it came to our harvest teams who are traveling to other hospitals and going to areas that potentially had a much higher COVID rates than we had here in Northeast Ohio. To ensure that, we made sure that all of our harvest team had the proper PPEs that they carried with them to the hospitals. In addition, we insisted that every donor was tested for COVID, and we had that insistence very early on before it even was a requirement at many of the centers. And only if they were tested negative for COVID, then we had our team travel there to harvest the organs. In addition to that, as we across the country started to understand how COVID was affecting us, we wanted to make sure that we minimize the risk, not just for us, but for all the programs. And whenever possible, we would ask wherever the donor was, we asked their local teams to procure for us, and in return, we would procure for them should we have a donor that they had a suitable recipient for. Because of these changes and because of the teamwork and the institutional support that we've received, we had been able to continue to offer transplantation for our patients. And in fact, at this time this year, we've done more transplants this year than we had at the same time last year, despite the fact that the number of donors across the country has decreased by about 20% because of the COVID. So this is truly a team effort that's allowed us to continue to treat our patients and give them the best care. And it is something that we continue to cherish and the foundation of our program. Thank you.
Thank you very much. I mean, I think this is in itself a remarkable feat for which we never really anticipated having to undertake. And you realize what a great team you have when you all come together and succeed in a crisis. I also want to focus a little bit on the adult heart transplant program. We have done an amazing job. Our 1 year survival is 97%, and our 3 year survival is 88%, which is well above the national average. Dr. Jerry Eastep is our section head for heart failure and transplantation, and he's going to talk to us about the challenges and innovations for transplantation for the adult arena.
So Eileen, thank you for the introduction and helping put this together. And it's a real honor and privilege to be part of such a robust and team that focuses in on quality. And there have been a number of advances really over decades that we're very proud to have contributed to as an organization related to better identifying the type of immunosuppression to provide patients, pursuing steroid-free regimens in select patients, and incorporating the use of non-invasive monitoring for rejection, not relying on biopsies, which is particularly important during the COVID times, in addition to screening for chronic forms of rejection that can affect the heart arteries with imaging techniques. And so we've been part of this journey, and there have been so many members of our group that have contributed to this that we're very proud of. A challenge that was certainly real related to the disparities in survival in patients that were plagued with end-stage heart failure. And in October of 2018, there was a change, if you will, in the heart transplant allocation score, going from a 3-tier system to a 6-tier system, with the thought of decreasing waitlist mortality in those that were most likely to die and the sickest in the hospital, but not at the compromise of survival after transplant. And so we now have a new system that we've adopted, and we've been very successful with. And certainly I look forward to talking as a group about these changes. But this challenge has been met in a very nice way in that we've been able to leverage our team. And you mentioned the team approach we have to use short-term devices, and there's been a fourfold increase in short-term devices to support patients. These patients are positioned highest on the list, and it allows us to minimize that disparity, and there's better sharing of organs in keeping with the new rules to allow us to best serve the patients we have to get those a new heart that need it the most. And so there have been a number of changes that we've adopted and have embraced, and I'm proud when I look at early observations in terms of investigations that we've been part of. When we look at the national landscape, there was a potential compromise in survival after transplant with the new allocation score. It was an early look, 6-month survival compared to the old system. And at our hospital, we've had in excess of 98+% survival since October 2018. And so you mentioned our survival metric, and it holds true. We're doing very, very well when we look at contemporary cohorts. It's just really a reflection of our team approach and our dedication to serve our patients best we can.
Thank you. And I think that one of the things I want to add for you is that you've really helped with the innovation by allowing us to actually use axillary balloon pumps to support our patients who are critically ill. No longer do they have to lie flat in bed, for which they then become, weak and not able to actually, ambulate right after transplant. You've now gotten to a point where actually you put it in an axillary position to enable them to be able to ambulate, to walk, to get up, so that when they go for their heart, they're really in the best shape possible and not debilitated. And I think that makes a huge difference and is part of the reason we have succeeded. I'd like to also introduce Dr. Edward Soltis, who is our surgical director for adult transplantation. And he's here to discuss actually the innovations as well as the challenges that we face for transplant and mechanical circulatory support.
Eileen, thank you very much. And it's really a true honor to be part of such a dedicated team of caregivers. We really live by the motto that there's no rank in the cockpit, and that applies to all the team members, from the directors of the whole program all the way down to those who care for our patients and answer the phone calls. As you've heard, we certainly have some tremendous innovations that have taken place in cardiac surgery, the management of patients with advanced heart failure. We have newer support devices that have enabled us to rescue patients who are critically ill and bridge them to transplantation. We have some temporary devices, and you've heard about the intra-aortic balloon pump that Dr. Hsich has leveraged that can be inserted into the axillary artery in the shoulder and really enables patients to sit up and do exercise while they remain in the ICU and wait for their organ. We also have more powerful temporary assist pumps, such as the Abiomed Impella pump. And these are available to patients who, again, are critically ill and unable to leave the hospital. We've also had tremendous advancements in our durable LVADs. These are the implanted LVADs, such as the HeartMate 3 LVAD and the HeartWare HVAD. And this really has revolutionized the care of our advanced heart failure patients and enabled them to leave the hospital and really safely wait at home for a heart. We really see the use of durable LVADs and transplants as complementary therapies to help our patients with advanced heart failure. We've also seen a tremendous evolution in not only simple things such as surgical technique, but in how we transport organs from the donor hospital to our receiving hospital at the main campus of the Cleveland Clinic. We have been part of a few trials now using the TransMedics organ care system, the Heart in the Box, where we actually reanimate the heart at the donor hospital and bring it back on the plane directly to our operating room while it's beating. We've also been able to utilize more donor organ hearts that have previously not been available to us, really because of the excellent treatment success with hepatitis C. Previously, we never accepted organs that were hepatitis C positive, and now we are doing that. And patients are having a much greater opportunity of receiving a donor organ with this opportunity. And finally, we're in the process right now of investigating the use of donors after circulatory death. This will hopefully open up a tremendous number of newer organs for us as we move into the future. So again, I want to thank everyone for listening and participating today. And Eileen, thank you for moderating. Again, we've had tremendous advancements, and we have a long way to go, obviously, to treat advanced heart failure in patients. But with 2,000 hearts, it's a tremendous accomplishment.
Thank you very much. Dr. Hsich, would you like to add some final words?
Yes, really, on behalf of the entire team, our dedication, our efforts, doing 2,000 transplants, being one of the largest transplant programs in the world, really has been a reflection of the commitment from so many others that you haven't heard of today. And the team approach, I think, is most important to highlight, from excellence in nursing, nutrition, pharmacy, and even including those in training, anticipating the next generation to carry on the legacy. And it's most important to recognize that we appreciate the patients trusting us with their lives. And while it may appear separate, our pediatric and adult heart transplant program, we're very much on the same page, and we share the same responsibilities. We have the same intent, and that's to achieve the best quality for our patients. We incorporate shared decision-making, patients first and front and center. And importantly, we're looking to innovate and improve upon transplant in general moving forward. So we very much appreciate the opportunity to care for our patients, and we look for the next 2,000 patients to help out with to come. Thank you.
Thank you. That's beautiful. And I just want to remind everybody that every pediatric patient becomes an adult at some point. So we are one team, and we always have been, and very pleased. So thanks, everyone, and continue to save lives.